I like a bed that's really firm.
I need something a little softer than that.
Rest easy. With the Sleep Number 360 smart bed, you can both adjust your comfort with your Sleep Number setting.
Can it really help me fall asleep faster?
Yes, by gently warming your feet.
Okay, but can it help keep us asleep?
It senses your movements and automatically adjusts to keep you effortlessly comfortable. Sleep Number, proven quality sleep is life-changing sleep. Don't miss our President's Day weekend special. Save 50% on the Sleep Number 360 limited edition smart bed. Plus special financing and free premium delivery when you add a base. Ends Monday. Special financing subject to credit approval. Minimum monthly payments required. See store for details.
Look in your home. Look in your office. Look in your home office. Everywhere you turn, there's so much smart. At Capella University, we think education should be smart too. Our game-changing FlexPath format puts you in control of your master's degree, so you can learn how, when, and where you want. Smart, huh? Yeah, we think so too. So if you want to take the next step in your career, make Capella your first step. Visit capella.edu to learn more. Capella University. Don't just learn smarter.
Welcome to the Beverly Hills Plastic Surgery Podcast. I am here today on a very, very lovely Wednesday afternoon to record this podcast with my co-host, Dr. Millicent Ravello. How are you doing?
I am doing very well, thank you.
I want to just point out today that lunch came, and there is a spelling of your name by our favorite local food joint that I would have never actually thought of.
Yes, shout out to Ronnie's Diner in Beverly Hills. They deliver us to all the time.
They're amazing.
They are great.
And they have created a new name for you, which I am going to stick with for the rest of the podcast.
Okay.
It is Melisente.
Melisente.
Mellesente. And I think it's missing an accent aigu at the end of that.
Melisente.
Yeah, so I think that we're going to go with that one today.
I like that. It just kind of rolls off the tongue.
So, Dr. Melisente Ravello, welcome. And we are going to discuss today what makes a good rhinoplasty.
Yes. So this is a critical topic to talk about, but it's kind of an amorphous one because the idea of what is good, well, that's very subjective.
It is. Beauty is definitely in the eye of the beholder, and that beholder being the patient, who it's most important that they are happy.
Most important that the patient is happy, but then you also have to understand that the doctor has his or her own aesthetic, and so what makes him or her happy is included in that as well.
Right. However, doctor happiness, much less important than patient happiness. It's not even close.
Agreed. But you're going to get the kind of result that makes the doctor happy.
If you can,
generally.
That's the best. Patient happy, doctor happy, winning combination.
Yes.
So the reason that I bring this up is because I have a lot of patients lately who've been, and after our last episode on social media, they ask questions like, well, I see this nose on so-and-so's profile that they did. How come it doesn't look good to me? Like, I don't like it. And I tell them that's because that's not your style. You're just not into that.
That's not your aesthetic.
Right. And that's what's hard to understand because, these doctors have huge reputations and they are well known and they're very good at what they do, but it doesn't mean you're going to like the results.
Right. So you don't have to necessarily be able to critique the results as a plastic surgeon would, but you do have to be able to look at a nose or a style of nose and identify it as something you like or don't like.
Right, because you're choosing like the nose you're going to live with.
That's the nose you're going to get.
Yes. Like don't go because he's got a fancy pants office and a great looking staff and a huge reputation and he hangs out with celebrities. Go because you love the work. You gotta love the artwork. This is such an artistic specialty that you have to understand this.
Right. And that's not to say that every single patient's going to have the exact same looking nose, because that's not necessarily the case.
No.
It's a custom built nose for each patient that fits their face. But on a whole, you have to look at the whole spectrum of that doctor's work and decide that you like or don't like their general, work that they do.
Right, because it's their style.
It's their style. It's their calling card.
I always say, if you like Monet, you wouldn't get Dali to do a mural in your house.
No.
You would get Monet because you like Monet.